Good morning, and welcome to the CRMSDC Business Consortium Hot Sheet Live. Believe it or not, this is our 11th special edition of Where is the Money? We're going to get started promptly at 9:30, but just wanted to let you know that we appreciate you spending your time with us today. This particular conversation is back to work, the new normal. Workplace reentry during COVID-19. So if you want information about all the elements of things that you're asking yourselves, if you're the CEO of your organization or if you're part of an organization, those things we're going to talk about for this hour. We have some dynamic people in place we'll introduce you to in just a moment. But before we get started at 9:30, this is a 1-hour conversation. We want to make sure that you have everything that you need around you so that you will not be disrupted and miss something good. And so make sure, and if you have attended any of the previous 10 conversations, you know what I'm about to say. Make sure you know where the bathrooms are, stay out the refrigerator, that COVID-related something else, and have your favorite drink ready, whether it's coffee, Bloody Mary, or mimosas. It's 5 o'clock somewhere. We're going to start in just 1 minute. Thank you. So thank you again for joining us. We have a lot to happen on today. If we could, I want to talk about who's going to be here, but make sure during this hour, if you could, follow us on social media. That would be a beautiful thing. But I'd like to bring on, if I could, some folks to kind of, I want to first bring on Dennis Smith, who will be the facilitator for today. And we're going to talk about, Dennis, if you can come on. Dennis, can you hear me okay? Okay, you seem like you might be having the same problem I have. All right, are you unmuted? Dennis, before we kind of bring our guest on to talk about today, tell me why you think that this topic is important.
Well, Sharon, returning to work in these COVID-19 times is a health and safety issue, and it can be a legal issue. And we want to make sure that our clients bring back their employees in as safe and as healthy an environment as possible. These are trying times, and We want to make sure that everyone is following the science and looking forward to a healthy and safe environment.
That's awesome. You're right. It is a conversation. I don't know how much of my conversation previously was muted, but as like many of us, when we look at adapting to the new normal, some of us are close our offices and telecommuting. When you have the conversation about bringing back children to school, people coming back to work, they want to feel safe. You want your employees to feel safe. And so we hopefully will have that conversation today. So Dennis, I think that if we, what we have on screen right now are some of our guests, and if we can bring them on, we can talk about the folks that have been selected to represent this topic today, which we've had some really top-notch folks, some great subject matter experts in this field, talking about the workplace in the new normal. And we will have those guests, but let's introduce them first. So guests, if you could join us on screen, that would be a beautiful thing. Okay. All right. And when I go off screen, I guess we can add one more. But first, ladies and gentlemen, back to work, new normal. I want to introduce, tell you a little bit about our moderator for today, and that's Dennis Smith. He's the project director of the MBDA Business Center, Capital Region. The MBDA Business Center, Washington, D.C., or Capital Region, is one of over 40 business centers across the country, and is funded by the Minority Business Development Agency, which is a bureau of the U.S. Department of Commerce. Mr. Smith has over 30 years of extensive experience in establishing and implementing policies and programs to maximize small and minority businesses participating in the acquisition of goods and services. And so thank you, Dennis, for you and your team, Ken Clark, Latoya Moore, that really had the vision about having this conversation. So we look forward to it. On my screen next to him is Donald Totley. Donald, if you can just kind of give us a nod or a wave. He's founder and CEO of SafePass IDS. It's a purifying sanitation system to work as the first line of defense against harmful pathogens. He's an innovative thinker with an extensive background in education, business operation, and business development. He earned his Bachelor of Science degree in biology from the University of Norfolk. Next to him is someone that you see a lot, been in our portfolio for quite some time, and that's Tony Hill, managing partner, Edwards & Hill Office Furniture. Tony has been the managing partner of Edwards & Hill Office Furniture since 1998. They are a commercial furniture dealership that provides furniture, supply and installation, interior design services, project management, warehouse services, and signage wayfinding services to clients across the country. Edwards & Hill Office Furniture completed the installation of the front of the house furniture for the Horseshoe Baltimore Casino, which was one of many things that they've done. And so next time you go into Horseshoe, pay attention. His company also applied and installed all the back office furniture and guest room furniture for Maryland Live Casino, Hotel, and Mr. Hill was featured in the Baltimore Business Journal among many accolades that he's received over the years. And he's our best communications person. He is a graduate of Morgan State University and holds a BS in telecommunications. And when you hear his voice, it will sound familiar and you'll say, oh, that's Tony Hill. We have next Dana Tershman, and she's an associate with Hogan Lovells. She handles transactions involving the development, construction, and financing of energy and infrastructure projects in US and in Latin America. Welcome, Dana. Dana, during law school, she served on articles and comments. She served as articles and comments editor for the University of Miami Law Review and as a research assistant on international human rights law. Thank you, Dana. Next to her is Elena Fernandez Portela, Esquire, and I forgot to say Dana Esquire as well from Hogan Lovells. Elena is staff attorney with Hogan Lovells. She focuses her practice on complex arbitration disputes in both English and Spanish in diverse industries like construction and telecommunications, among other sectors. In law school, she received the Outstanding Advocate Award for her active role as a member of the Florida International Law Moot Court Board of Appellate Advocates and International Arbitration Team. She also served as the president of the Law Student Division of the Hispanic National Bar Association. Ernesto Sands, law clerk, Hogan Levels. Ernesto is the law clerk, and he has extensive experience in capital marketing and M&A and joint levels infrastructure, energy, resources, and projects practice to assist with domestic and cross-border transactions. Ernesto attended the University of Pennsylvania Law School, where he obtained his law degree from an award certificate in business and public policy. So welcome to all of our guests today. We're going to break this down and unpack it and talk about certain aspects of returning to work. And with that, I'd like to keep Dennis back on as I thank our sponsors. Ladies and gentlemen, he will bring you on in just a moment, but I have to thank our sponsors, because without our sponsors, we would not be having this conversation. Without our sponsors who understand the importance of supporting minority and women-owned businesses, and we understand the access to capital, access to opportunity is important. And so, Ernesto, I'm glad you joined, but you guys can go off camera now. But just Dennis, before I hand it over to him. And so you'll see, again, thank you to our sponsors. And I think the next slide is maybe what? Okay, the fireside chat. Dennis, I turn it over to you, and I'll see you back at the end.
Thank you, Sharon, for your leadership and support. We welcome you to this webinar, and hopefully will be an informative discussion with regards to returning to work, getting back to the new normal in the workplace. Our first panelist is Donald Totley. Donald, please come on board. He's an innovative and founder of SafePass Intelligent Disinfecting Station. Donald, tell us about SafePass IDS and your innovation to returning to work.
Yes, so SafePass Intelligent Disinfection Station is a station that's designed to, one, meet the two mandates of mass detection and temperature scanner. So it takes your temperature and verifies that you have on a mask. After you've met those minimum requirements, then you'll step into the station where a motion sensor will activate. You'll take the hand sanitizer, and the vaporized hydrogen peroxide mist will disperse at 200 ppms, as well as the far low UVC lamp will come on. Collectively, the system has a 99.9% pathogen kill rate. So the whole purpose of the disinfection station is to be able to significantly reduce and mitigate the transmission of the virus.
All right. And have you had it's in operation somewhere?
Yes. So currently, I've sold over 140. Some in Malaysia and theme parks. Floyd Mayweather is currently using one in his nightclub. I have several in churches, some schools, some DC Housing Authority, Fast Med Urgent Care, in discussions with the NBA now to use those, to use the stations as a way to bring the fans back into the arenas.
Okay. All right. And we're going to see if we have any questions out there. Ken and Sonia, do we have any questions out there that we want to ask Mr. Totley?
Yes, good morning, and thank you, Dennis, and thank you, Donald, for your introduction about your technology and process. I'll just make a comment. If anyone has any questions that they would like to ask any of our panelists, please put those questions in our Q&A box. You can type that in. We will do our very best today to get to all of those questions. And if not, we will address those and send those thereafter. Donald, there is a question in reference to what considerations would an office or a building have to take or have to consider in order to put this type of technology in their facility?
Really, it's just a matter of just the space. You know, what we found is that most of the companies and office buildings, even some of the stores that's using it, has really, the station has been able to restore the consumer confidence and help people get that sense of security in knowing that, you know, some measures have been taken to safeguards. So there's no real consideration outside of that. You know, since this is a new technology, there was initial concerns about the far low UVC being used on the human body, but now studies have shown that that's actually a safe approach. So there, outside of the basics, there's no real consideration except for the allocation of space for the station.
All right.
Hey, Donald, this is Donald Ken Clark. It's amazing how much the whole world has suddenly discovered light. In this case, UV light, because there all of a sudden there are a number of UV light installations or products coming on market, including the hand wands and lights in the HVAC. How safe is UV light? You touched on that, but there has been a lot of concern about cancer-causing impact of UV effect on the eyes. Can you tell us more about that?
Yes. So actually, our technology has we have a patent pending technology in a filter system where we're able to omit the harmful rays and introduce a system by which those harmful rays are not being exposed to the human body.
Okay, and I'll follow up on that. Is that safe? Is it really safe for children? Because I mentioned you mentioned
Yes,
schools.
Yes, it is, because our filtration system is able to omit the 254 wavelength that's harmful, and we actually replace that harmful wavelength with a blue light technology. So, and we're actually in the process of doing research and development with the University of the Virgin Islands, who verifying the efficacy of the station and the technology.
Okay.
All right. Okay, this is wonderful. This is wonderful. Donna, you're from Norfolk State, huh?
Well, I'm actually from DC. I just graduated from Norfolk State.
All right. Okay. All right. And this intelligent disinfecting station, we hope that it gains some traction, and you will in fact be a client of the Washington DC Business Center, and we look forward to your success, and we will be promoting your product.
Thank you. I definitely appreciate that.
All right. Okay. Thank you, Donald.
All right. Thank you.
All right. Okay. We will now move to our next panelist. Our next panelist is Tony Hill, President and CEO of Edwards & Hill Furniture. Mr. Hill, we welcome you here.
Thank you, Dennis.
All right. Mr. Hill, you have a presentation that you would like to make about the workplace and how to make it a healthier and safety one as employees come back. Right.
Sure.
Please give us your presentation.
Sure, and this is just so that folks can have a visual, because sometimes it's hard to visualize these things. But everywhere you can't have that 6-foot separation. And then there are situations that show that the virus can be transmitted farther than 6 foot. So we want to do what we can to protect folks. So this is just one of the ideas here, plexiglass that can be put around a workstation. And we can go through and you'll find that we'll have other ones that show you how they can be used. And we can design it specifically for your workspace. Here it's around a workstation. Again, if someone were to cough and not cough into their sleeve, at least that cough, that spray is going to get knocked down and not be transmitted throughout the office space. We could do that in a frosted if for some reason the person needed some level of privacy. Here are some privacy screens that some of my clients are using because if we're lucky, this is going to be a temporary situation and we're going to have a vaccine at some point. So some folks don't want to retrofit their actual furniture. These screens can be pushed between workers to give them that protection. When it's over, they can push the screen out of the way, put it in storage. If we can move to the next slide, those are mobile dividers. Here's another situation where you've got an L-shaped desk. And again, there are different applications, but here we've got some clamps that go around the top of the workstation and brings the glass up, because the whole rage has been for the last many years that we want collaborative spaces with these low panels so everybody can talk to each other. Well, now with COVID, we need that protection. So here's an opportunity to simply, instead of trying to buy new furniture, adding these plexiglass toppers to the existing workstations and creating that additional privacy. Here's a situation where you may have folks checking in at a front desk, maybe in hospitality, at a hotel, at a convention, whatever the case may be, and you've got some of these plexiglass toppers that you can sit on the desk to, again, provide some level of protection between all of the people that will be coming up at any given time and interfacing with the folks who are working at that desk. And then here's a situation with a classroom where you have been able to put a plexiglass provider around each of the desks, again, to provide some level of protection. And as I think we all know, with everything that we have learned about the virus, there's still some that we don't know, but we do know that as much as you can protect when folks are talking, when folks are coughing, when folks are shedding that virus, as much as you can confine it to an area and not have it spread, the better off they're going to be. So we can do all those things. Here's another application for school. It's an X-top that you can just sit on the table. And with all these applications, there are many, many others. And then the final one is, if you don't want to do any of those things, but you have the room, we can come in and do a reconfiguration of your space and create the separation where you're getting folks at least 6 feet apart. We can design that for you and hopefully help you reuse the furniture that you have and or new furniture or add in to do what you need to do. And a lot of people are taking advantage of it now while they don't have a lot of people in the office, so that when we do come back, they'll be ready to go.
All right. Well, let's take some questions. Sonia and Ken.
Great, thank you, and thank you, Tony. We do have some questions coming in. We do have someone. What are some of the challenges that you're hearing from your clients in reference to how they're having to adjust and the different things they're having to do around developing a workplace organization strategy?
Yeah, I think the biggest thing, and the other gentleman who was on, Donald, I think it was, who mentioned it, it's giving the folks that work in your space or your clients or your guests a level of comfort knowing that something has been done to mitigate the issues. And so one of the things that we have challenges with, I've got one client in particular who we've put some measures in their office space, but they've also ordered masks from us. And they have a rule in their space that when you're sitting at your desk, you can take your mask off and you can work. But anytime you decide to stand up and become mobile, moving throughout the office, then you must put on that mask. So it's really providing, I think, a level of satisfaction that something has been done.
Okay.
Tony, the unfortunate part about the virus is that it is airborne, and even within the confines of the plexiglass arrangements you have air will eventually come up and go over possibly the top of the plexiglass protection. How important is it, or have you helped the design systems where the companies need to put in additional air filtration units in the space, or improve their overall airflow through a filtered system that's also has something like UV light in it? Do you get involved in recommending that also?
We haven't gotten involved in the UV light, and no clients have actually bought them yet, but we have looked into adding air purification systems to help purify that air. And again, it's kind of getting back to the answer that I just gave. It really is giving folks just a sense of security that you have taken measures. Because again, I think, let's face it, there's really nothing we can do at this point that's 100%. So all we can do, and that's all of us, no matter what our vocation, is to mitigate those circumstances. And so, yes, we can help with filtration. We can also look into other things. For instance, I could call Donald and say, hey, I've got a client who's interested in doing this. I understand your product works with that. And I could bring that in as an offering. But at this point, we haven't had clients get that concerned about that portion of it.
And as a follow-up question, Tony, we just had a question come in. What is the best way to address interaction in common areas? Any suggestions or thoughts on that?
It's going to be social distancing and wearing masks. You know, in my office, and we happen to have a showroom and private offices that give us plenty of social distancing. We're all still working remotely. We go into the office when we need to, and when we do, we still wear masks and we still social distance. So that's going to be the best thing that you can do. If you have an area that's set up for people to be in close proximity, we could come in and move some of those items out or move them apart if you have the space. We also could put in some of those plexiglass dividers that you just saw between sections of, say, your soft seating to help in situations like that. So there are different options there as well. But the best thing is social distancing. Even some doctors' offices will remove, say, if they've got 4 chairs along a wall, they may remove 2 of them or take 2 of them and lean them up against a wall someplace else so that they can't be used, so that only the 2 chairs existing, one at one end of the wall, one at the other end of the wall, is where somebody will be sitting, so that it'll keep them at least 6 feet apart.
Tony, bars are one of the places that everyone is very concerned about as being super spreader places. Casinos have 2 things: groups of people, excitement, and floating bars. The people carry trays of liquor around. How did you deal with casino arrangements that you did for, I think you did Maryland Live? What precautions were taken there?
Yeah, we did. Now, we didn't supply them with the protection for COVID. However, what they are doing in casinos is you do have to wear your masks. And similar to a restaurant or a bar, as you were saying, those are probably the toughest environments because people are consuming food and drink. And that's one time when you just absolutely cannot wear a mask. So what you want to do is to make sure that you have plenty of hand sanitizing stations for those folks. Make sure that you have masks for them, or mandate that they have to wear a mask when they're in the space. And then you have to make sure that they abide by that. Now, all the options that I showed you on the slides and others, plexiglass dividers, safety shields, and so on and so forth, can be done. But that is a particularly challenging environment. And the best, we all in our different vocations can do a lot to help with this, but it really starts with the individual. We've got to make sure that we're protecting ourselves from the environment and protecting others in the environment from us. And so that's where we can help, but that mask is really going to come in to play in a situation like that.
In your opinion, have you had any, have you done any studies or read anything detailed about what creates the best mask? Because there are a lot of things on the market. Some I've seen have been pretty flimsy. What have you seen in that regard?
Sure, and yes, we have. There's everything from the masks that have a vent, which they say is good for the person wearing it, not as good for other people, because when they breathe out, you get more of their breath through the mask. The rule of thumb that I've been hearing and reading is that you should multiple plies. If it is single ply, then it's not going to knock down that virus as much. The gaiters, as they call them, that are kind of like a turtleneck that you put around your face and it's around your neck, those are not as effective. And one of the simple things that people can do is to take your mask and hold it up to a light and see if you can see light through it. And if you can, the more light you can see through it, the more the virus would pass through it if you were to sneeze or a cough or when you're talking. So you want multiple layers. And then you also have the mask that I wear has 2 layers, and also I have a filter that goes between the 2 layers that I can change that filter. So it's mostly about layering. The more layers, the more you're going to knock that down and not have the virus go through it. And that's breathing or talking.
And do you sell those masks?
Masks as well?
I'll tell you, the particular mask that I'm telling you about, and we do still sell masks, yes, but the particular one I'm telling you about that I wear, I can't get any more. I can't get any more. We bought a few thousand, and I don't know why. It may have been overwhelming, but the company that made them stopped making.
All right.
We can get you others.
All right. Thank you, Mr. Hill. We'll bring you back later and if we have some additional questions. So stick around.
Thank you, Dennis.
All right. That's right. Our final group of panelists is from the law firm of Hogan Lavelle. We want to thank Airbus Americas and its lead diversity representative, April Johnson, for presenting us with Hogan Lavelle. The lawyers representing Hogan Lavelle are Ernesto Sands, Alina Fernandez Portela, and Dana Turgeman. Ernesto Sands, please.
Hello.
That's right. You guys have a presentation?
Right.
Please present. Let us know what the liabilities and pros and cons of workers coming back to work.
Sounds good. Thank you very much, Dennis. I'm Ernesto Sands, and I'm a law clerk in the Miami office of Hogan Lovells. Basically, our conversation is going to be regarding issues that business owners may face upon returning to work. Next slide, please. We've split up our presentation into the legal considerations and best practices, which includes in-office precautions that can be taken and a discussion regarding COVID-19 waivers. I'll be discussing the legal considerations, and my colleagues Alina and Dana will cover the best business practices. Next slide, please. Okay, one more. Excellent. So the takeaway on this slide is that employers are already facing lawsuits, and more are expected to come as more individuals go back into work. We wanted to highlight a few of the claims that are currently being brought, which include wrongful death, discrimination, workplace safety, retaliation, and whistleblower claims, and employee leave and benefit claims. And out of all these claims, we want to highlight specifically the wrongful death and workplace safety claims, because they usually go hand in hand with the reopening and the return of workers to the workplace. And we would also like to highlight that our presentation should not be taken to be providing specific legal advice, but rather we just want to highlight general legal principles and best practices as we are currently seeing them in the marketplace. Next slide, please. And so tying up with the claims that are being brought, essentially the claims rest on whether the employer followed guidance and is up to standards. And guidance could be provided by either entities, which include the Occupational Safety and Health Administration, OSHA, or the Center of Disease Control and Prevention, the CDC. But it could also come from governmental entities, which could range from the federal government, so the national government, state governments, or localities. For example, here in the state of Florida, in the beginning of the COVID outbreak, the state itself didn't issue a stay-at-home order. Rather, it was left up to the individual counties to keep up to date with whether they wanted to keep people in or not. And so, depending on where you're located, you're going to have multiple sources to keep track of and keep up to date with, because OSHA and CDC, for example, are constantly revising their guidance and new guidance is coming out. Next slide, please. And finally, we just, on the legal side, we just wanted to highlight that there's certain considerations with medical information. So HIPAA, which is the Health Insurance Portability and Accountability Act, protects medical information from patients, from employees, from anybody. So employers may or may not have the right to require an employee to disclose a COVID-19 test, for example. And you have to be very careful navigating whether or not you could ask that from your employee or from anybody else. And so that's a specific place where you might want to reach out to legal advice and see how you could navigate that area. And finally, again, with the theme of staying current with the legal updates, there's legislation. We've highlighted one of them, which is the Safe to Work Act, which may be coming out at the state or national level. The Safe to Work Act is already in the National Congress, and it would protect employers from certain liability. And so depending on if certain acts pass, you may be more protected in the future. With that, I've covered all the legal considerations, and I turn it over to Alina to talk about some of the best business practices.
Please go forward, Alina.
Thank you, Ernesto. As you noticed during my colleague Ernesto's presentation, it is important to know the legal consequences of COVID-19. However, to avoid being found liable, the most important thing is to plan for the safety return of the employees to the office. To that end, all business owners should implement good control practices, such as the ones that you're going to see in the next slide. Some of these things are already part of what we consider normal, such as staying home where you're sick, covering your mouth when you cough or you sneeze, washing your hands regularly. But this is something that we also have to implement in the office, and we also have to train employees on how to do. So if you could go to the next slide, please. Social distancing is perhaps the most common phrase of 2020, but what it means is in the workspace, it means to provide the employees with a safe space where they can practice social distance, when they can be 6 feet apart. And some of these measures we already saw in the presentation of Tony Hill. How can we rearrange the office to make sure that we are observing social distance, that we're following the CDC guidelines, and that we're making sure that we're doing everything that we can so we are not legally liable for any misconduct. Next slide, please. Face covering is as important when it comes to being in a space where you have multiple employees. And the most important part of face covering is training the workers on how to put the mask, how to use it, and how to take care of correctly, including in the context of, for example, if you're gonna have the employees use the mask in common areas. As Tony Hill also was mentioning, many of the employers are allowing the employees when they're in their desk not to wear the mask, but when they're in common areas, this is a good practice to follow. Next. And lastly, obviously, cleaning and disinfecting, it is as important as all the other measures we have been talking about. But the most important part is providing the employees with the necessary equipment that they need. For example, provide them with tissues, providing them with no-touch trash cans, providing them with hand soap, hand sanitizer, which needs to contain at least alcohol, with disinfectants, and obviously making sure that not only the common areas but also the personal space of the employee is being cleaned after every working day. But for that you need to or it would be a better practice to provide the employee with the things that they need in order to accomplish this. So with that, I pass the microphone to Dana Tershman.
Thank you very much, Alina. And just want to touch base on what we call COVID-19 waivers. And this is another tool that businesses can consider when reopening in order to minimize the risk of liability from exposure and transmission of COVID-19. It is important to stress that this should be used in conjunction with other mitigation measures, especially what we've discussed over the course of this presentation, following CDC guidelines as mask wearing and social distancing, but it should not be taken as a standalone measure. And there is no guarantee that a COVID-19 waiver will be enforced. And so we want to make sure that other measures are implemented in order to minimize the risk of liability. And so what is a liability waiver? It is essentially a contractual provision by which one party agrees to relinquish the right to recover for certain injuries. In this case, for injuries caused by COVID-19 through exposure and transmission of COVID-19. Usually businesses may require customers, vendors, and other non-employees to sign waivers. It is of very little value and likely unenforceable to have employees themselves sign COVID-19 waivers, particularly because there are, on a state level, there are systems of worker compensation schemes. And so a waiver cannot waive a right that is already protected as a matter of public policy. And so it might not be as effective to have employees sign it, but it also undermines, when it comes to employees, undermines the confidence that the employees would have in the employer, that the employer has taken it seriously and following COVID-19 safety workplace guidances. And so that is another factor for not using COVID waivers with employees. And next slide, please. So talking about the enforceability of COVID-19 waivers, it is a very fact-specific determination whether a waiver is enforceable, and it also varies from state to state. It is very important if any of the businesses are considering having a COVID-19 waiver that they do it under the advice of counsel, and that the counsel is very knowledgeable of the state law and state requirements in order for to make sure that it would a court would deem a waiver enforceable as a matter of state law. Usually, some states will not allow a waiver to be effective if they find that there was gross negligence or intentional acts or willful misconduct on the part of the employer. For example, not implementing any of the CDC guidelines, not social distancing, not wearing masks, not implementing any safeguards, that even if there's a waiver that was signed, it would not likely be held enforceable. And some of the factors that courts may consider, since I mentioned it was fact specific, they would look at a waiver and see the way that is drafted. Is it conspicuous? Does it is it something that is very plain and is easy to understand by the party who's waiving it? Is it in capital letters, for example? You want to make it as short and clear as possible so that a non-lawyer is able to understand it, and that it plainly explains the risks and legal rights that are being waived. You need to make sure that the way it is drafted, that there's consideration exchanged in the waiver, that in order for it to be enforceable, both parties, there needs to be an exchange of value for both parties. On the part of the waiving party, you can have consideration of the waiving of the right in exchange for participating in a certain activity or for entering a business's premises. You also want to make sure that it is signed. As plain as it is, we want to make sure that a waiver has been read and understood by the person who's waiving their right, and so it needs to be signed. And when it comes to minors, they're usually voidable if they're signed by a minor. So you want to make sure that a minor's parent or legal guardian also signs the waiver and releases on the minor's behalf. And finally, as a matter of public policy, and we touched on this earlier, sometimes it will be deemed unenforceable, like in the context of employees. And then finally, you want to make sure that you keep track of all the waivers that are being signed and they're kept in a safe location in the event that those are questioned as to their enforceability.
All right, thank you, Dana. Can the three of you come back again? Ernesto, Nalina, and Sonia and Ken, do we have any questions?
Yes, thanks everyone for your presentations. Dana, one of the things that you were just talking about waivers that was actually coming in quite frequently in the chat box, everyone wants to know, are they enforceable? So thank you for covering that in detail at the end. One additional question though is, what are the other recommendations that you would advise to offices, businesses in terms of protecting themselves? Any additional insurance or riders on policies that people should consider?
So obviously we talked about the CDC guidelines. That's a very important aspect of making sure. And then other things, you definitely could look into insurance and those kind of other protections. And we are starting to see the law develop in terms of what safeguards, and Ernesto touched on this. You know, there might be more protections coming our way later on in the future, but at this point, those are kind of the things that we know of. Yeah, I don't know if Alina or Ernesto wants to add to any of that. Wait, you're muted.
So you're on mute, Ernesto. While he's working that out, Dana, has there been any case law or in any actual trials and rulings regarding waivers so far? I know this is a matter of public policy, but normally the precedents come from cases.
I think that it's too early. Some of the sources I was looking on, it's too early on the waivers. We are starting to see cases come up in the context of claims for, I think Ernesto was mentioning wrongful death and other claims, but speaking specifically on the waivers, it's kind of too new for that. And, yeah.
All right.
I'm back off. I'm unmuted. So if there was a question, I apologize for regarding. Was there a question regarding like what sort of claims are being brought?
Yes.
Yeah, I would. One of the cases that I dug up, which is interesting, and it's just to highlight what sort of claims could be potentially brought. There's a case for a gentleman called Wando Evans who was working in Walmart. He told his supervisors that he had COVID-19 symptoms, and the supervisors essentially just told him, "Hey, keep working." As the symptoms worsened, then he was finally sent home 2 days later, and then 2 days after that, unfortunately, he was found dead at home. And so the family is bringing a wrongful death claim, a negligence claim, saying that Walmart didn't follow the CDC guidelines and like OSHA guidelines. So that's, I think, where the case law is really developing.
Okay. All right. When an employee claims that they are sick or feel some sickness coming on, that employee oftentimes is then charged with sick leave. Are those sick leaves being waived in these circumstances?
I don't think they're being waived, and I think that's actually ties in with what we're seeing. I think it's to the employer's benefit to really be sharp with any sort of symptoms that an employee might be facing, to say, hey, take your sick leave, because otherwise you could even bring a claim apart from if the person worsens or contracted COVID at the job site, or otherwise he could also bring claims that you didn't give him his sick leave.
Right.
But claims for the other employees in that environment. For example, the Walmart employee is ill, but the people he's told to continue working, and all the other employees are around there. And if any of them get sick, what's the liability?
Essentially, those are all claims. Those are all going to be claims.
Yeah.
And in that case, not only waiting for the employee to say, oh, I'm sick and I feel bad, but the employer should be actively engaged with employees to make sure that they have a system in place, make sure that they have maybe a person that is in charge of keeping track of everything and follow up with everybody to make sure that they actively like seeking these employees that might have symptoms and might not come forward. So that's really important too, because a claim can be brought if an employee is not being actively involved on these type of like prevention measures.
Yeah. All right. What we're going to do now is we're going to bring everyone back on, and we're going to take questions from the other panelists. Donald and Tony, please come on back on. And I'm going to take myself off in order for Donald to, in fact, appear. And Sonia and Ken, please get some questions for everyone.
Yes, great. And thanks everyone for your presentations this morning. We do have additional questions coming in. Donald, specifically in reference to SafePass ID, some of our attendees would like to know what, can you talk a little bit about maintenance of the system and what installation and costs are associated with that?
Okay, so we actually have two different versions. We have a 1.0 and a 1.5 version. The difference in the two being the 1.5 is wheelchair accessible. It releases the vaporized hydrogen peroxide on both the left and the right side, as well as it has a far low UVC at the top and the bottom of the station. So the 1.0 is 16,500, and the 1.5 is 18,500. The installation, we have a national installation team. The installation is $850, and then we also have a maintenance and servicing warranty package. So the first 6 months is free parts and labor, a warranty, and then we also offer an extended warranty.
Great, thank you.
Oh, can I say also, in addition, we also have the mini temperature terminals and mass detection units as well. So we also have the standalone devices that will also be able to use our contact tracing app that's in development.
It sounds like from the legal side that Donald, you just got an endorsement for all the things that people need to be doing in order to protect themselves, waivers or not. Is that true from the legal team?
Yes.
Okay. All right, and I would think that the same thing is true for the protections that Tony is offering in terms of shields and well, of course, the mass social distancing, but shielding employees around are also other valid arrangements to help avoid suits and liability. Yeah.
And
Tony, have you had any? Go ahead. Sorry.
Sorry, I do one thing to add. The CDC guidelines and other guidelines are constantly being updated, so it's not okay just to just what came out in July implement those policies. You want to be able to keep up to date on what's being published, both on the state, federal level. So want to make sure that that is a constant exercise.
Sonia?
Yes, Ken, I thought you had a follow-up question. My apologies for the delay. I did have another question that came in, and this is to the Hogan and Lovells team. How did you handle an essential employee who refuses to come back to the office when all the CDC guidelines and the best practices have been implemented? Any thoughts?
So I think, I mean, you have to be obviously on a case-by-case basis, the determination, and that obviously that all the steps have been taken, and you have to be, I guess, like an internal discussion. Maybe that's the way that we have seen it in our office. Internal discussion with maybe the office manager, the business owner, and the employee, because that person might have like a legitimate reason not to come back to the office, or a healthy or a health consideration that you may take into consideration as a owner, and might create other arrangements for that person. So I think that question comes in a fact specific basis, and it's hard to answer in the context of what to do for everybody, because everybody's different and might have different reasons for having concerns of going back to the office.
Yeah, and to add to that, employment laws are very state specific. And so that is also another factor to take into consideration what will be deemed wrongful. I mean, if he doesn't adhere to coming in and terminated because of that, you also have that issue of wrongful termination. So it is a very also a state specific and fact specific as well.
And Tony, go ahead, Dennis.
If that employee doesn't come back because there's someone in the household who could be endangered, have there been any test law in regard to that?
I was tasked with looking at the case law, and that's a very specific scenario. I didn't come across that, but it's a great scenario to consider, because more than likely that will come up. And I think that touches upon one of the things that we said, that there are very specific scenarios to each individual employer, and that employer would be advised to discuss those scenarios with specific legal counsel and touch upon all the issues that you've just raised, and say, hey, this is my situation right now. Like, we've made all the efforts to make sure that the business is safe according to the guidelines as most recently published, but this employee is still refusing to come in. And then you have to look at the contracts that you have with the employee, a bunch of considerations, and that's best done with individual legal counsel.
Yeah.
Tony, are there any office engineering issues that we haven't covered that you will want to comment about?
I don't know that we haven't, Ken, but kind of like everything else, there's so many different opportunities for there to be an issue. Some that we've thought about, some that we haven't. And our folks from Hogan Levels can tell me, but I think all you can do is to give it your best shot and try and make sure that you've done everything that you can think of, showing your best efforts to have done something. I think if something is pointed out to you, or if an employee has a concern, then I think you need to do what you can to address it if possible. But this still, in many ways, legally and otherwise, is just a moving target. I think we can just do our best.
And I think,
All right.
sorry, I just wanted to add, I think there's also that morale aspect to it. You want to make sure your employees are comfortable and are feeling that they can come and be safe and work without worrying about contracting COVID. So that's also an aspect to consider in implementing all these safeguards.
If I could say very quickly, we've got an office in St. Louis, and have a client in St. Louis who wants to do some retrofitting. Not that he really needs it, but he wants his staff to see a difference when they come back to work. And I agree with him wholeheartedly. He agrees if they come back and see that everything is just as it was when they left, that they won't feel safe. Even though guidelines are already kind of in place based on how the space was already designed, but he wants to add some stackers so when they come back, hand sanitizing stations, et cetera. So when they come back, they see that, they did something. Hopefully they'll feel more comfortable with coming back to the workspace.
All right. I want to thank each of you for coming on and presenting to the business community. And should the business, and we hope to answer some additional questions, and we may even have to give you guys a call back to help answer some of those additional questions. So thank you all very much so for coming on. And we at the Capital Region Minority Supply Development Council and at the Washington MBDA Business Center, we'd like to thank you all. Thank you very much. And
Thank you all.
Sharon, please
Thank you
come
for
on back on and wrap us up for today. Sharon, you're muted.
Oh, seems like I would get, can you hear me now? Seems like I
Yes.
would be used to this by now, right? It's our 11th webinar. So anyway, thank you, ladies and gentlemen, for being our subject matter experts for today. I've been getting some rave reviews in terms of how informative this session has been. And so kind of a takeaway is that, you know, COVID has offered us a lot, some good things, some bad things, but in terms of the innovation that companies such as Donald is seeking as well as Tony Hill's pivoting in terms of understanding what his clients will need or prospective clients, and then understanding what the legal aspects are. So this whole, it seemed like we could take this show on the road. This whole package of information has been quite informative. But here with you, and thank you, Dennis, for leading us through this effort, and Sonia and Ken for being what we call our question whisperers, and this audience for coming up with some great questions. Contact information for these individuals are what you see in front of you. As we move forward through this journey called COVID, we know that we'll have some questions. Information from today's session will be posted. You'll be able to see this webinar again, as well as the questions that were asked, and those that were asked and we didn't get a chance to answer, we'll answer those questions and post them as well. While I have your attention, as we kind of wrap up, I want to tell you kind of what's next. We have another webinar coming up, but we are continue to pivot as an organization. We know we have our hot chat webinar, just as one we've done today and the 10 others. We created during this time our hot chat newsletter, and so now we're moving to our hot chat podcast. And so we're having our first one of those on November the 5th, where we will feature David Bird, who is the National Director of the Minority Business Development Agency, U.S. Department of Commerce, and MBDA is the proud benefactor for today's session. Our funding comes from our CARE Act supplement. And thank you, Edna Robinson, for being out there today. So we enjoy her as well. And we have veterans. Veterans are very important. So the day before Veterans Day on November the 10th, we have our next webinar, is contracting opportunities and resources for veteran businesses. But before we go, I want to also tell you about some other things that are happening with the council. If you are not members of the council, maybe you want to consider doing that, because we continue to rock and roll. One thing we're introducing this month is our Lift as We Climb Mentor Protege program. We also have been given funding, and that's being sponsored by BAE Systems and Capital One. And then our MBE, the Ultimate Business Makeover, looking at those companies that may be suffering during our COVID period, or as also as a result of the social injustice that's going on. We're looking at taking a triage of advisors, going into some selected businesses and doing and helping those businesses from a legal perspective, financial perspective, business development perspective, peeling back the onion to help those businesses sustain and grow. And December the 3rd is our annual business meeting. We'll be doing matchmaking. And so we have lots coming on, but we promised you an hour. It is 10:31. I'm sorry I took another minute out of your day, but thank you to our sponsors again, and thank you for participating in our Hot Sheet Live as we continue our journey of finding out where is the money. See you next time, and guests, again, we can't thank you enough.
Thank you, Sharon.
Thank you.
Thanks.